this room, just turn off the two-way data. Okay?
Okay.
I think goodbye.
Okay, people are just beginning to log on now, and I'll get underway in a minute.
So we've got 52 participants.
It was 270 something registered as of about an hour ago. Right. So I hope that number is going to climb. We are broadcasting live on YouTube as well.
Oh. Is YouTube live?
Yeah. Well, really? There's a 20-second delay on it, but yes. Okay, it's 4 o'clock, and if you're all ready, we'll make a start as more people join us online. So, ladies and gentlemen, good afternoon here from Asia. Good morning to those of you joining us from Europe. Welcome to this, the latest webinar from the EU-ASEAN Business Council. This is now our 25th webinar since the start of the COVID-19 pandemic and the lockdowns across the Southeast Asian region back in March. So we're getting rather used to these. I'm Chris Humphrey, the Executive Director of the EU-ABC, and I will be moderating today's session. We're here today, as you can see on screen, to discuss vaccine confidence in the time of COVID-19, Asia's time to act. Vaccine confidence has never been more important as the world waits for its first COVID-19 vaccine, which we hope will be very, very soon. This becomes an important issue, because beyond COVID-19, life course immunization will continue to be an integral part of keeping infectious diseases at bay and a critical and yet currently underutilized public health defense. Indeed, here at the EU-ABC, we've done a lot of work this year on sustainable health initiatives. And of course, a key plank of that is ensuring that lifetime immunization is available and people have the right information about it, because doing so does reduce the burden on health systems, which is of course something that's been very prominent in the news this year. This panel discussion is designed for stakeholders across the vaccine ecosystem and also includes media. And on it today, I hope we can explore the barriers to enhance vaccine confidence in Asia, a multi-sectorial solutions for increasing vaccine confidence across the Asian region, and also some short and long-term actions that different stakeholders can put into action to enhance vaccine confidence. It's a very key and important area. Some housekeeping before we get underway. All our attendees, please, you can use the Q&A function at the bottom of your screens to pose any questions to us. Our panelists, I think, are more than happy to answer questions. We have with us today a very esteemed and very experienced panel. We have Professor Tiki Pangestu, who's a visiting professor at the Lee Kuan Yew School of Public Policy at NUS here in Singapore and a former director of the WHO. We have Professor Dr. Zulkifli Ismail, who is Secretary General of the Asia Pacific Pediatric Association. He's also a consultant pediatrician and pediatric cardiologist at KPJ Selangor Specialist Hospital in Malaysia. Dr. Nam Chung Chu, who is the Chief of Department of Pediatrics at the Mackay Children's Hospital in Taiwan and the Director of Taiwan Pediatric Association. And last but not least, Salma Khalek, who is the Senior Health Correspondent at the Straits Times here in Singapore, who has a long and distinguished journalistic career covering health issues across the region. So, good afternoon, I think, to all of you. I hope you're all well. And if you don't mind, we'll perhaps launch straight away into the first of the questions, because this is a key topic, and I'm sure there's going to be plenty to debate over the next hour. And I'd like to start, please, with Professor Pangestu, and maybe Dr. Ismail, you may want to jump in on this as well. But the first question really, I think, is about vaccine confidence levels in Asia and about it being an ongoing issue. So we all know that vaccination beyond childhood is not really well understood across the region. Often elective vaccination rates are pretty low, and that's certainly true here in Singapore for the elderly and more vulnerable in the population. So what more can we do, in your opinion, to remove significant barriers to improve vaccine confidence across Asia? And what do you see as the different barriers for different age groups?
Thank you, Chris. I will be very brief because I'm sure we will elaborate as the panel moves along. For me, the single most important and significant barrier to improve vaccine confidence in the region is the spread of misinformation, falsehoods, and conspiracy theories, which is creating fear, confusion, and reduced trust in the importance of vaccination. So I feel quite strongly about that is probably the most significant barrier. I think in terms of different primary barriers for different age groups, once again, just very briefly, I think if you're talking about children, the pediatric age group, fairly straightforward. Most countries have mechanisms for delivering vaccines through schools, for example, but immunization of older people and adults, obviously, that's much more problematic in terms of delivery, in terms of logistics, who delivers the vaccine? Is it public sector? Is it private sector? Where do you actually deliver the vaccine? It's much more complicated. So I'll leave it at that, and we can elaborate on some of these issues later. Thank you.
Chris, I agree with. But I think there's no one single barrier to vaccine confidence. If you look at the WHO's 3 C's of confidence, convenience, and complacency, it's a multifaceted issue. And of course, that growing anti-vaccine influence on social media needs attention. There's a lot of misinformation and disinformation on social media, and that needs to be addressed. Here in Malaysia, this is probably local, and probably it also affects Indonesia because religious influence and sentiment also makes a difference. And in our data that we've got from Ministry of Health from 2013 to 2019, we've seen an increasing trend of vaccine refusals in the rural areas, in the East Coast and in states like Sabah, which is in East Malaysia. So I think we should go away from thinking that vaccine hesitancy or vaccine refusals is for a start. Chris, thanks.
Okay, thank you. Sorry, yes?
I believe that the major barrier for vaccination is the fear for vaccine adverse reactions. And since the confidence is based on trust and knowledge, so I think before we use a new vaccine or just to give the public the vaccine, we should let them know what is vaccine. The knowledge should provide to them. If they know what's the vaccination for and how it works and what's the possible adverse effect, and know that sometimes events after vaccination, not due to the adverse effect, not due to the side effect, but it can be just incidental. If the public knows this and they can understand, I think the confidence will grow up. And the confidence needs trust. So the professional, the expert should tell the public what they know and let them know the vaccine is good for the public.
Dr. Chia, perhaps I could just follow up with you on that. I mean, it's all well and good saying that we need to have more knowledge about vaccines and what's good for them, but who should be driving that sort of conversation? Who should be responsible for providing support to people like yourself to get the information out there about what vaccines are available and the benefits of them?
Because usually the public, they rely on the message about the health message from the healthcare professionals. However, healthcare professionals, not all the experts for vaccination. For example, a gynecologist, they may not know what vaccine is. And if they give the public the wrong idea, then will cause a big problem. So I think the government should tell the public why we should use vaccination. And the special society, for example, the infectious society, and sometimes some society, then we called TIVIS, that's the Taiwan Immunization Vision and Strategy. That's the similar to Global Immunization Vision and Strategy. That's the GIVS. Now, we'll give a proper message to the public. And of course, the manufacturer, if they provide a new vaccination, they should also give this kind of message to the healthcare professionals. Because if the healthcare professionals, they can have the confidence, and then they can tell the public with their own confidence, and then the public can accept it.
Chris, can I jump in here?
Please, Sama, yes.
First, I agree with the three gentlemen with a bit of provisos. Okay, I agree that social media has been it's the bane actually today because of the, I think WHO calls it the infodemics. The amount of information that's coming out, not all of it is accurate. So that's very difficult to tackle. But what Dr. Chu said earlier, and what you asked him, whether it should be a doctor who tells patients about the vaccines available. Honestly, I don't think so. I don't think a doctor has the time during a consultation to convince a patient that they need the vaccine. And knowledge of what is available, I think, is very low, even in Singapore. So a lot of adults here don't even know maybe that you have a vaccine against shingles. Many of them are not aware of the pneumococcal vaccine that can prevent meningitis and reduce pneumonia, some types of pneumonia. So you're right, who should give that information? I think both the government and the pharmaceutical companies, the ones who produce it, should also inform, and the government. And obviously the media also has a role. I mean, I'm not going to say, no, we don't have a role. We do have a role. And yes, doctors have to understand the vaccine. So when patients ask them, they can answer correctly. But it's not their job to sit down for 15 minutes to convince a patient that they should get a vaccine.
Yeah, but as you said, doctors should explain what vaccine is if they were asked. That's no problem. And because doctor has many kinds of doctor, so I think the expert doctor for the vaccination should stand up, and maybe in the media, they can tell the media, the journalist, reporter, the correct message, because that's very, very important. And sometimes even a small wrong message can destroy a good vaccine program. So maybe one good way is to have something like a conference for the doctors, for the nurse, and maybe there's some press conference for the journalist, reporter, and let them know, and then they ask what they think about. Then that will reduce the problem.
Can I just make a comment, Chris? Sorry, I don't mean to take this away from
please
you.
do.
Well, I was thinking the stakeholder groups that, if you look at studies all over the world, when they look at confidence on vaccines and look at stakeholder groups that the public actually trust, they actually trust the medical professional organizations like the Pediatric Association, the Medical Association, the the ONG Association or the Nutrition Society and the colleges of pediatric physicians and all that. And then after that comes the individual healthcare workers, as Dr. Chu has mentioned, and then the MOH, the Ministry of Health. Newspapers come in at the end after that, Salma. The newspapers come in after that, and the magazines, and of course the internet. So, you know, it still boils down to professional organizations. You know, I run a group called Immunize for Life, which actually gives information on social media, in newspapers and all that, on immunization from the womb to tomb. So, and you can access it on the internet, you can access, and it comes out on Facebook and all that. So this is a way that we can actually pervade into or invade into people's lives with regard to immunization. Okay, that's my take on it, Chris. Thank you.
Thank you.
Yeah,
Whilst
Chris,
sorry, yeah,
Chris, if I can just add to what Zul said, perfectly agree with what has been said about the importance of professional societies, you know, the right kind of medical expertise, the importance of media, private sector. But I would just like to add to this the important role of the community in terms of actually at a level, not even of communities, but in Indonesia, for example, at the level of even local neighborhoods. We have a system of sort of village and household sort of small groups. We call it the RT and the airway. These are groups of households, about 30 to 40 households. And these are small local neighborhood communities where I think, you know, if they were adequately made aware of what the key messages are, could also play a very important role. Thank you.
thank you. Dr. Ismail, I'll come back to a point you mentioned actually in your opening statement earlier about reactions from different groupings in different countries towards vaccinations. And I think the Malaysian Health Ministry actually is named Kedah as one of the states with the most vaccine rejection cases, particularly for children, for MMR. I just wonder, in your experience, are parents becoming more or less trusting of immunizations as a key child preventative health measure? And do you think there are any lessons that can be learned from pediatric immunizations which we can take forward for adult vaccinations going forward?
You're breaking up a bit. What was the last part of the question?
Yeah, sorry. Is there any lessons that we can draw from pediatric immunizations for vaccinations for ill?
Right. Okay. Well, generally, pediatricians advocate strongly for vaccination and the immunization, and we actually have to get our adult physicians and the obstetricians and all the other physicians to come on board. You know, to get, say, infectious disease persons to talk about vaccination is a bit hard to do. And, you know, like I said, the public look to the doctors and to the professional organizations. And then we actually do not give them facts because although, you know, graphs and bar graphs and pie charts are nice to look at and appreciated by the public, but what they look at is storytelling. They actually relate and actually identify. They identify with stories rather than with facts and figures. With regard to your earlier statement about the rural areas of Kedah that you've actually researched on, it's true. And this is all tied to actually very Islamization and Islamic states. The Kedah state of Kedah and the East Coast are very Islamic states. And there is this belief that having vaccination is un-Islamic. It's not just in Malaysia, it's a broader part of Indonesia as well. It's sharing that kind of view. And we're actually trying to break that by actually getting to the public. It may have gone away from your main question, but I thought I'll just add that in.
That's no problem at all. I think we can all say this. Vaccine confidence actually is very difficult to build up, but it's very easy to knock down. So which stakeholder, I mean, I think you've already alluded to all of this, but which stakeholder groups or sectors can best collaborate to improve vaccine confidence across Asia? And I'm thinking we're looking ahead towards a possible soon COVID-19 vaccination to help us get through this pandemic. I mean, how are we going to communicate for that and indeed for other general immunizations that they're going to be safe to take? Who'd like to go first? Professor Pangestu?
Yes, Chris, I think, hold on. As I mentioned before, I think it really is about collaboration between all the key stakeholders, and I don't think any one particular group stand out. So clearly it's a sort of a multi-sectorial collaboration between government, professional societies, media, importantly, private sector, companies, civil society, and as I mentioned before, community faith-based organizations. So that's sort of those are the major stakeholders.
Yeah, I would agree with what Tiki has said about the collaboration and cooperation. And I think the cooperation between government, private sector, as well as CSOs is important. And, you know, as long as the message the same. But I think we have to actually not ignore the influence of social media influencers. These are young people, young trendy YouTubers and Facebook guys who actually have a following of thousands. Calculate and get them on board to also be promoting vaccination, rather than they going to the naturopathies and the natural healers and saying that this is better than vaccination. Then we're in trouble.
Yeah. So Salma, perhaps I'll bring you in on that if you don't mind. I mean, from a media point of view, you're representing mainstream media. So there's a role there for media to play in getting information across and perhaps preventing balanced views. But how can media also help influence the social media side of life?
Social media is a very difficult animal to tame. I think normal vaccines and the COVID-19 vaccine, there are huge differences. For existing vaccines, we know quite a lot about them, whereas for the COVID-19 vaccine, it's very new. And we need information as much as everybody else out there. I think in this particular case, the WHO should play a bigger role in seeing what information the social media is circulating, because people believe that. My friend sends me the information, it may be wrong, I don't know, but I believe my friend, so I send it on to my friends, and the situation really gets really bad. So if the WHO can pick up all these things and then put it on their website so that we can access and find out, right, this is being said, is it true, is it not, why is it true, why is it not? A central body doing that, I think, would be very useful at this time.
Okay, Professor Pangestu, you worked at WHO. Is it equipped to perform that sort of role?
I would say the answer to that is yes, but I think the big issue there is how many people actually are able or are aware to actually go to the WHO site. And this is where I think social media companies like Facebook, Twitter, and Google, they've actually done their bit in terms of directing people who are searching for this kind of information to then direct them to reliable sites. And it's not just WHO, it's the US CDC, for example, and the professional associations all over the world. So yes, definitely, I think a lot of people, especially developing countries, look towards the WHO.
Okay.
And I believe local government should step up for any wrong message in the first beginning as soon as possible, because rumor will transmit very quickly. And if the local government, and they can collect the data and they can explain to the public, then maybe we can put the fire down before they spread widely.
Chris,
rumor seems to spread much faster than COVID, actually.
Yeah.
Chris, can I just add a little bit? I think Zul and Salma have raised the issue of the difficulties in dealing with social media. And, from my own reading, I'm sort of citing other sources here. There are apparently nearly 3 times as many active anti-vaccination groups as there is pro-vaccination groups. And these anti-vaccine groups are also much more internet savvy. They are better at using diverse platforms and they use much more compelling messaging. Okay, whereas the public health people amongst us, we tend to sort of be very monolithic. As Zul said, we like to use data and graphs. It's not convincing. We need more stories. We need to be more savvy, more diverse to reach sort of different types of people. And remember, not everyone is an anti-vaccination. The majority of people are undecided. That's the group we need to target. And that obviously includes young people. And it's young people who can then influence their parents. So I think that's an important thing about sort of, the challenge of dealing with social media. And I guess my point here is focus on the hearts and the minds of the people, not just trying to overwhelm them with science and data and information and graphs. Thank you.
Yeah, agree with that.
So you're all in violent agreement with each other, which is excellent. I'm not sure we're getting to solve the problem, though, of making sure that people have access to the truth and the information that they need to make an educated, proper decision. And I think the social media point is a good one. I think in the Philippines, during this COVID-19 period, anti-vaccination groups and Facebook have gained another 200,000 followers, which just shows you how hard it is to try and tackle. It doesn't mean, of course, they're subscribing to that view. They may just want to hear what the other side is saying. So is there more of a role perhaps to play for frontline physicians as well in getting this information out?
Well, yeah, of course. I mean, the frontline. The thing is, I remember reading a study that if the physician actually tells you that the person needs influenza vaccine and has the influenza vaccine in the clinic, it's about 5 or 6 times more likely that the person will accept the vaccine rather than if the doctor never broaches the subject at all. So we should be actually training healthcare professionals. Again, I'd like to just bring up I'm not advertising here, but I'm just going to bring up about the Immunize for Life program. We started one early last year, and the whole of the last year, we did this training program for nurses and primary care physicians in the whole country. So we sort of did it in relation to vaccine hesitancy and refusals. So how do you approach parents who come who are either unsure vax in their opinion? So and we've got a psychiatrist involved. We got on board other professionals, the infectious disease guys and all that, so that we conduct this all over the country. So I think this is one way that we can actually do it. I mean, obviously, every country has to assess what it is in their own country that is the major cause of vaccine hesitancy and refusal. And obviously the frontline physicians talking to the patient will make a lot of difference and we have, mind you, there are also doctors who are anti-vaccine. So that's an issue that we have to tackle as well. We have to identify them, and we have to actually then turn them over, sort of. Thanks.
Okay, thank you. A reminder to our audience, please, you do have any questions, please use the Q&A function at the bottom of your screens. I do have some questions that have come in, and I'm going to link, I think, two of them together. One is that some people are just skeptical about vaccines simply because they don't have enough information, and the rushed introduction and the confusion around efficacy levels for, say, a COVID-19 vaccine aren't helping. So the question is, what are the standard metrics to get a vaccine out there and approved? And another question, I think I can relate to it, but I will twist it slightly, is, and how credible are the vaccine producers, the pharmaceutical companies, in the eyes of the public, and indeed, for that matter, how credible are the approving authorities amongst governments, people like the US FDA? Anybody want to take this one?
It's a
You
very
touch on the fears that a lot of people have because the COVID-19 vaccines are being rushed. So the question is, when it's rushed so quickly, do we have all the information we have, right? And in terms of the approving authority, because the governments are so desperate for a vaccine, are they allowing shortcuts? So those are the questions I'm getting to as a journalist. I'm not a doctor, but that people are asking. So I think these are questions that have to be addressed, not just once, but addressed time and again. And they have to show how no shortcuts are being used, why they are able to do it so quickly, to explain it properly.
yeah, those are very
Traditionally,
pertinent issues. Sorry, Dr. Chiu, carry on.
okay, sorry. Traditionally, a new vaccine, it takes maybe years before they can put to the market. But during the COVID-19 pandemic, even under such circumstances, actually the vaccine, if it can be used, it still needs a lot of procedure, and they pass the procedure, they can get the license to be used. And another way to let the public maybe have a little bit more confidence is there should be a monitoring system and a compensation program. For example, in Taiwan, we have the monitoring system for all the vaccination, and we also have the vaccine injury compensation program. So if anyone who get a vaccine and have something wrong, maybe not due to the vaccine, but they concern maybe that, and this program can help them and to give them more confidence. That's my opinion.
Yeah, unfortunately, not many countries can have the financial resources to have a vaccine compensation program. When we wanted to make it mandatory to make immunization mandatory in the country, there was a lot of opinions from the other side saying that if you do that, then you have to have a, and this is where the anti-vaxxers used the thing to actually twist the arm of the government, and in the end, vaccine compensation. And like I said, probably United States and probably Taiwan and Korea have the financial stability and the financial capability to actually have a vaccine compensation.
Yeah, Chris, if I can just add to what's been said, I think obviously, as Salma mentioned, the speed at which these vaccines are coming on, and recently there was a little bit of a mistake in the trial of the AstraZeneca vaccine in terms of dosages. That adds to the fear and the confusion and the distrust. You know, is it being fast-tracked both from a scientific perspective as well as from the regulatory perspective? So I think, you know, once again, I think the government has an important role to play here. And let me just cite the example from South Korea. And this is just 2 weeks ago. They had a major scare around flu vaccination, where as usual, the usual story came out, people were dying because of the flu vaccination. You know, same old story. But in that particular case, the government acted very quickly. They gathered the data, they gave information to the public very quickly, and they stood up very strongly to defend their vaccination program. And within 2 or 3 weeks, the whole thing sort of died down. The vaccination program came back on track. So, quick action, I think, transparency, accountability to overcome this sort of fear and distrust that Dr. Chu already alluded to.
Yeah, and the Minister of Health even had the vaccine in public, so that actually made a lot of difference. You compare that with what's happened with the dengue vaccine, Dengvaxia in the Philippines. That's another issue that got. But the effect is not just on that vaccine. Because of that vaccine, the uptake of measles vaccine, the uptake of all the other vaccines have dropped. And you just had outbreaks of measles all over the Philippines over the last few years. So, that's why we cannot afford to have a vaccine that either doesn't work, have adverse reactions, or severe adverse reactions, even if whether it is related or not related. Because then you're going to have this issue. It's going to affect the whole immunization program. So we're very concerned about this. I mean, our Ministry of Health is concerned, and we don't take any vaccine unless there is actually enough data. And then we also are quite wary about this new, as everybody's been saying, I notice everybody's wary about the speed with which the COVID vaccine is coming out, and we are and it is now politicians deciding and businessmen deciding on which vaccine to buy. I think that's not right. The proper health technology assessment has to be done, and I agree with our Director General here, who said that it has to pass through health technology assessment, and that's an issue, and now because the money, there's so much of money coming out from there, everybody's trying to get some in their pocket. I think we're going out of the discussion here, Chris, but it's quite pertinent.
It is. Perhaps I'll just try and drag this back from, I know everyone's COVID-19 is front and center of people's minds, but immunizations, of course, is a much bigger thing than just COVID-19. Huge as that now currently is. I mean, what can we do more to make populations across the region more familiar with the benefits of life course immunization? So influenza jabs for the elderly, MMR for children, from a very early age. What more can we do to make sure that the messaging is getting out there that these things are necessary and they're good for the entire population, not just individuals?
One thing comes to my mind, that's the education even earlier in the school. Because even in our medical school, vaccination was hardly being mentioned. So if in recent years, we try to put vaccination into the part of the school education, maybe that takes years. However, it may change the thinking about the vaccination. If the child, the children, they learn about vaccine is good, is safe at their school, maybe more people can accept that. That's one of my opinion.
Yeah, Chris, my response to your question is, this is really addressing the bigger issue of universal healthcare. And the focus should be on primary care and prevention rather than, fancy, expensive hospitals. So once again, the key to all of this, managing the pandemic, ensuring that healthcare as a whole is not neglected, is robust, resilient, and sustainable healthcare systems that provides equitable access through the goal of universal healthcare.
Chris, can I take exception to something you said?
Yes,
you said that vaccines are necessary. Now, while I support vaccines in general, not all vaccines are made equal, right? Some are more effective, others are not so effective. Some have they have different side effects. So I think you can't put a general umbrella and say all vaccines are necessary. So it's up to the individual. So if it's 50% effective, do I want to go for a vaccine that is only 50% effective? You know, and then people are more likely to accept vaccines if it's a one-time only jab. The flu vaccine, you have to do it every year. After a while, people lose enthusiasm, especially if, okay, fine, I got the vaccine, I didn't get the flu. I haven't had the flu for 10 years. Do I really need the vaccine again? You know, and cost is another factor, I think, for some people.
Okay, that's all fair enough. I'm sure Professor Pangesta will come back on the flu vaccine. There is actually one question on the Q&A, which is linked to what you were just saying, Salma, and it says regarding the Korea flu situation, seems Korea managed it well, but in Taiwan, the media handling was bad and the cause is a big loss of confidence. So how can journalists help improve accurate reporting? And Salma, perhaps I'll ask you that, and then maybe Dr. Chu can refer to the specific case in Taiwan.
Okay. Actually, we have a few cases that have a Guillain-Barré syndrome after the vaccination. And the media reported even in the first head title, so caused a big issue. And there's also some people die after influenza vaccine. But actually, Taiwan CDC responds very quickly, and we tell the media what all the cause of death can be found not related to the influenza vaccine. And however, always somebody who do not believe what government says. And media, sometimes they try to make things even hot and more hot. And so I think the one thing very important is the expert, so-called expert, is really expert, or actually is someone who did not know, who does not know vaccine clearly. So to handle this is very hard because you cannot control the media actually. So I think try to give more press conference and then the reporter can get what they want, maybe still the best way.
Salma, do you want to add anything?
I like that last bit that Dr. Chu said, give the reporters what they want. That's the best way. And he's absolutely right. You have to be fast with the news and you have to be fast with the facts, right? Before somebody else gives the wrong impression.
Yeah.
Okay. Still time for the audience online, please, to give us some more questions. There's one question here, which I think is probably aimed at COVID-19 vaccine, but could equally be applied to any immunization or vaccination. So one of our audience has said, whatever I've heard so far will not convince me to be vaccinated. Would all speakers here agree to be vaccinated? And if yes, which one would you choose? And that's clearly designed to COVID-19. But let's just ask you, in general, would you take vaccinations? Would you take a flu jab, for instance? Would you take I don't know, a dengue vaccination or any sort of vaccination, really?
Okay, I'll take first go with that. For the last, I can't remember for how long. And, you know, I may have skipped 1 or 2 years, but that's because I work in, we're supposed to be high risk. You know, we're exposed to patients every day. I also had my Tdap vaccination against pertussis when my daughter got pregnant. So I didn't want to bring pertussis or whooping cough to my grandchild. And then I also got, no, I did not get the dengue vaccine because it's not available, it's not registered in the country. And whether the COVID vaccine, I'll leave it to the other 3 panelists to answer first.
Okay, let me have a second go at this. I think the first point I'd like to make is, you know, as Salma said, whether you choose to get vaccinated is an individual kind of decision. In my own personal case, I'm scared of needles. Okay, I just don't like to be, you know, stuck with a needle. And the second case, I think it depends, as Zul said, on your immediate sort of environment. I don't have grandchildren, okay, unlike Zul, And perhaps I'm not working in a hospital sort of frontline healthcare environment. I deal with students. We're all socially distancing. So I probably, although I'm in a vulnerable age group, I'm probably less likely to take the flu vaccine.
Yeah.
The second point I'd like to make, and this is probably more around COVID, is this perpetual dilemma between individual responsibility and the good of the community. Okay, do you take the vaccine to protect yourself, or do you take the vaccine to benefit the community as a whole? That's a much bigger question to sort of answer. Thank you.
Okay. I think which kind of vaccine should be given depends on the epidemiology of your local area. So I received any vaccine that was told should be given by our government in our area, because I believe if this vaccine can be put into the market, its safety is good enough. So I think I accept that.
Okay, can I take this in two parts? Let's start with the COVID-19 vaccine. Okay, I think whether people get vaccinated or not depends very much on the circumstances in their own country. If COVID is spreading like wildfire, then I think there are more chances that people will go for the vaccine. In Singapore, it's pretty much under control. So I don't see an urgency. I would rather wait and see and get more results from other countries getting the vaccines before I go in. On the other hand, my mother is 97 years old. So she's in a high risk group. So then I have to balance that, you know. If I get the vaccine, I also protect her because I go out, I meet people, and I don't want to bring the disease back. So these are the things I have to look at. It's not it's not spreading in Singapore very much, but my mother is at risk. So I have to decide on my own. As for other vaccines, no, I don't do the flu vaccines every year because Singapore doesn't have a winter season. Yes, we do get flu here, but the risk is very much lower. Like Tiki says, I'm not terribly fond of needles either. So do I want to go and get my jab every year to prevent something that is possible, but not highly probable? But I will be going for my pneumococcal vaccine because that's only 2 vaccines for the rest of my life. And that should give me pretty high protection. So I will bite my teeth there and go and get my jab.
And Chris, you know, this raises the big $64 question, you know, in countries like Indonesia, where COVID is really just out of control at the moment. Do you go the way of mandatory vaccination? I mean, that's another big issue in the context of government policy.
I'll just pick up the point that Salma just raised there about influenza in Singapore, indeed in the tropics. According to the National Center for Biotechnology Information in the US, Singapore regularly, in a normal year, have 240 people out of 100,000 hospitalized for influenza. And so it's not an insignificant number in Singapore. So influenza is an issue in the tropics. It's not just a temperate climate thing. So what more perhaps can we do about making people understand about things like influenza in this part of the world?
Chris, 240 out of 100,000.
Yes, hospitalized, not just sick, actually hospitalized.
That's less than 1%.
It's still
right. Most of those who get hospitalized do recover.
Yes, but you know, we were here in Singapore and we were having like 300, 400 people in our hospitals, not our community facilities, with COVID-19, and everyone was getting very worried. So the point is, it's still a high number, and Singapore's influenza numbers are roughly the same as you'd get in many temperate countries in terms of hospitalizations. So lifetime immunizations or yearly immunizations with something like influenza become important.
Well, if you give me a lifetime influenza vaccine, I will go for it. It's because you're asking me to do it every year. I had done it for some years until I finally said, you know, no, enough is enough.
My opinion is that
medical professionals want to come back on this one.
Can you give us an idea, a simple mathematical count? If you get influenza, you may need to be hospitalized. And if you get the vaccination, you hardly get the influenza. Or sometimes you still get the influenza, but usually it won't be so severe. And the adverse reaction, the rate of adverse reaction is rather low. So compared with that, I still think we should receive the influenza vaccine.
By all means, promote the flu vaccine. I've got no objections to that. But personally, I've only had the flu once in my lifetime. And then at that time, I took flu medication, Tamiflu, and it did reduce the severity of the flu. So now that we have got 2 or 3 medications to reduce the severity of the flu, I felt, well, okay, maybe, as you say, it's a personal decision.
We had an increase in the uptake of influenza when there was an outbreak, I think at the end of 2019. There was a surge of cases of influenza, and our wards were actually full of influenza A and B. And at that time, when I looked at the influenza uptake for the whole country and also for my hospital, there was a 90% increase in the uptake in the months of December and January, and then in February it tapered down. So when you have something like this, and then the media comes out with it and then tells you that there is this thing about an outbreak and all that, and it comes out every day, then people actually start to cheap. So people came because it is affordable, so they came up to get it. Yeah. Similarly, in 2012, we had just 2 deaths of children with rotavirus gastroenteritis, diarrhea caused by rotavirus. The uptake of rotavirus vaccine also went up a few months after that. So when you have something in the media that's that shows that there is something is happening, then people will start to come up and look for prevention.
Okay, I'm going to pull this discussion back to a more general theme around vaccinations. And there's one question on the Q&A is, how can we, or should we not be using role models, so either in localities or in different age groups or target groups, to provide better advocacy for vaccinations? How would you see about going there? So we perhaps go to community centres and we get someone influential there in the community to spread the news about it, or we can use, I don't know, millennials on their different social media platforms and try and encourage them to be.
Wasn't that what Taiwan's minister did? And it was effective, wasn't it, Dr. Chu? Yeah.
I think communication is very important. And as a infectious physician, I am, and I think we should have any possibility to connect with the media or the community and let them know what we can do to prevent the infectious disease. That's what we should do, all we can, what we can. And sometimes I think very important is that, sorry, maybe somebody maybe don't like to hear that, but media always like to say something not good, not something good. And a vaccination, they prevent a lot of death, a lot of disease, but usually it won't be reported. However, if a single case of adverse reaction may be put in the headline. So we still need to communicate with the reporter and the journalist to let them know what's the real situation, what's the real real things we need to do.
Well, honestly, as media, we try to get information out as fast as possible, but we want to have the truth. So we need to get the information. And as Dr. Chu says, the faster the government can come back with responses, the better it is to counter whatever else is being said out there.
Chris, we have actually used celebrities to promote vaccination. It's been pretty effective when we look at the hits in social media. So when we use celebrities, people actually get into the social media, but we don't know how much that actually has influenced them their decision to actually get the vaccine. We haven't followed celebrities. And then the other one is, like I mentioned earlier, social media influencers, and they have millions of followers, and these guys can be on our side, and these are who we actually use. Other than when you have a big event, the press will only come if the minister comes. So then obviously we have to invite the minister. But celebrities and social media influencers have been used, and we found it quite useful.
Okay, thank you. We're coming close towards the end. There are lots of questions on the Q&A, most of which are related to COVID-19, and this discussion, of course, goes broader than that. But I will try and wrap them up together into one question for all four of you before we start to bring the discussion to a close. And I think the question is, what level of vaccination for COVID-19 do we need to achieve in the communities so that we can then, I don't know, start to travel again and feel that we're safer traveling around the world and back to our jobs, and perhaps people can then start returning to their offices and see friends and family more often. So an unfair question perhaps for Salma, because you're not a medical professional, but I think for the other three gentlemen, what sort of level of coverage would you be looking for a vaccine on COVID-19?
I'll leave Dr. Chu to answer that.
It's very hard to answer because there are so many kinds of COVID-19 vaccine, and sometimes not all the, I don't know which country can get what kind of the COVID-19 vaccine, and different COVID-19 vaccine may have different efficacy. So the result is very hard to answer, so it takes time, maybe a half year, I think, maybe still needs. Some country may get some COVID-19 vaccine earlier, and they can show us some data. However, some countries still need a lot of time until they can get the vaccines. And also there's another thing is about the economic condition, because the COVID-19 vaccine may be not so cheap. And even though there's a COVAX system, now try to give every country have the opportunity to get COVID-19 vaccine, but it still takes time. So till now, I still cannot get a good answer for that.
Chris, you're asking about the herd immunity, really. I mean, you're asking about how many % of the population needs to be vaccinated. But I think what the COVID-19 vaccine for the time being is about is actually protecting the individual so that the individual can go traveling everywhere. But to expect like measles, you need to have 95% of the population immunized before you can get herd immunity. I doubt if that's actually how the vaccine will work. I mean, Dr. Chu may.
Yeah, I agree.
Okay, thank you. You had a good stab at it. We're coming close to the end. I will ask one question for all of you. Perhaps you can answer it in turn, and perhaps Salma could answer it at first, please. In your view, what would the most urgent priority be for public health bodies and policymakers across the region to improve vaccine confidence? So perhaps Salma can go first, and then Dr. Ismail, then Dr. Chu, and then finally Professor Pangestu.
I think it's just information. You need to tell people about it. It's like, I don't see it as the media's role to try to increase vaccine confidence. Our role is really to tell people what the vaccines can do, what will happen if they don't take the vaccines, what are the risks if they do take the vaccine, what's the level of efficacy, and then let the people make informed choices. So I think the decision has to rest with the individual, but they must have all the facts available for them before they can make that decision.
Yeah, okay. I think you just have to get buy-in from the professional medical information that they give to the press will then have to be disseminated to the public. That's how I'd say.
Yeah, I think before a new vaccine launched, and so So there's a lot of messages should put into the media, and that should let the public knows what the new vaccine is. And during the vaccination program, should respond to adverse reaction soon as possible and as transparent as possible.
Okay, Professor Pangastu, final word to you on this entire subject.
Yeah, I mean, it's all been said. I mean, it's really all about raising public education, awareness, and trust, especially when these COVID vaccines are being developed so quickly and amidst those report of mistakes. And as I said before, you know, focus on the hearts and minds to overcome this confusion and distrust, and, you know, to sort of target, you know, I think the anti-vaccination community is, to be very honest with you, they're beyond help. No matter what you say, they're not going to change their minds. It's ideological, it's emotional, it's totally denying the evidence. The pro-vaccination, also, you don't have to worry about those. It's that group in the middle who are undecided. Okay, you look at the bell curve, it's the middle of the bell curve. Thank you, Chris.
Okay, thank you very much, all of you. A fascinating discussion. I'm sure we could have gone on for much longer, but we do need to bring this to an end. Apologies to the audience for those that asked questions that we didn't get around to. Salma, thank you very much for your insights. Thank you, Dr. Ismail and Dr. Chiu and Professor Pangastu. As always, been a pleasure having you on our webinars again. I wish everybody to keep well, keep safe, and keep happy, and all have a pleasant rest of the week. So thank you very much, everyone. Thank you.
Thank you. Bye-bye.
Bye.
Bye-bye.